My name is Franch, and today I'm going to tell you about antibiotic resistance. There are millions of tiny bacteria living all around us, in our beds, in the food we eat, and even on our skin. Although these bacteria are microscopic, according to the National Academy of Sciences, the total biomass of bacteria is greater than that of all the plants and animals in the world. Some of these bacteria are healthy and even necessary for bodily functions such as digestion, while other ones can be extremely harmful and even deadly. Have you ever been prescribed antibiotics? It'd be hard to find someone who hasn't. According to the IMS Health Midas database, every person has had an average of 22 doses a year, a dose meaning one pill. This leads to the issue of antibiotic resistance. Antibiotic resistance is the capability of some bacteria to be immune to the effects of antibiotics. This occurs due to a random mutation that allows some bacteria to have a leg up on others. The antibiotics are then prescribed and come and wipe out all the non-resistant bacteria. Then the resistant bacteria have absolutely no competition, are allowed to flourish and form superbacteria. An example of this is MRSA, a very deadly infection that is growing across the US. The process of antibiotic resistance is being accelerated due to the misuse of antibiotics in plants and animals. However, many steps are being taken to fight back. The figure on the left displays the antibiotic resistance enzymes, beta-lactamase, increasing since the year 1970. And on the right, this is the increasing number of MRSA patients in the hospital since 1993. Due to the seemingly miraculous capabilities of antibiotics, there have been many abuses in the medical community. In 1945, Alexander Fleming, the founder of the modern era of antibiotics and the discoverer of penicillin, warned us, the public will demand the drug and then will begin an era of abuses. One of these abuses includes incorrect prescription. The Center for Disease Control, the CDC, depicts that 30 to 50% of all prescriptions are prescribed incorrectly, leading to overexposure. Another issue is lack of regulation. Many countries don't have any regulations and have antibiotics available over the counter. They're way too accessible, they're cheap, and they're in abundance. This leads to a lot of overuse and being used when not necessary. Another issue is it's being used for agricultural purposes. For example, many farmers give their cattle and chicken antibiotics to prevent diseases ahead of time, but and that gets transferred to us through the consumption of food. The first resistance case was in 1950, ampicillin, according to the Institute of Pasteur. At first, their only method of combating antibiotic resistance was through finding new antibiotics, but as you can imagine, that well eventually dried up and they had to resort to finding different ways. Now, we try to improve antibiotic use through new regulations and stewardship programs. According to Dr. Russolini from the Department of Medical Biotechnology at the University of Siena, these stewardship programs showed a 37% increase in correct prescriptions. Another important method is tracking methodologies of this resistant bacteria. The collaboration of the CDC and National Healthcare Safety Network, they have created a system to automatically alert them when there's any case of resistant bacteria. It is then tracked and traced back to its spot and then hopefully contained. The last method that should be a no-brainer is preventing infection and diseases from the start. And theoretically, this would eliminate any need for antibiotics. This could be done through following the CDC's guidelines in hospitals or simply just washing your hands. So, although antibiotic resistance continues to be an increasing threat, many new research and new methodologies are surfacing worldwide, and corporations have been working together across the globe to fight against antibiotic resistance. And here's my assist.